Today's guest is Colleen Reaume, Executive Director at the Hospice of Windsor in Essex County. Colleen, welcome to today's show.
Good morning. Thank you for having me, Robert.
My pleasure. How are you and your family doing during these difficult times?
We are adjusting, and we are extremely grateful to be healthy, to be quite honest. If we have our health, there isn't anything that we can't conquer, to be quite honest, in this time.
Okay, how has COVID-19 impacted your staff and operations?
Like everyone else, it's been quite an experience to navigate through this. And I would say at the very beginning, what we had to do was really look closely at what was essential and what was not essential, so that we could make sure that we were focusing all of our attention on the important work that we were able to do safely for our patients and our families. And one of the first things that we did was, really recognize that things like our wellness programs that had very big groups was not something we could continue safely. So we had to work on transitioning and closing some of those things and then focusing all of our attention on essential items. So for Hospice of Windsor and Essex, the two things that are most essential for us is the work in our residential homes and the work in our palliative medicine program, which is basically the work that we do to take care of patients and families in their own homes. So those were the two buckets of essential work that we really quickly had to focus our attention on and make sure that we were recreating ourselves to be able to do all of that work very efficiently and very safely for the patients and the families. I think one of the examples I would give for that is no matter where the patient was, we had to think about how we were able to deliver service. So we know that so much has changed in healthcare, and for us to be able to deliver the optimal service, we had to think about doing things differently, such as virtual connections. So for patients in their homes, for instance, we still, of course, had to do a really good screening and risk assessment, and sometimes still go into the patient homes face-to-face. But at the same time, we were really learning very quickly to be tech savvy in our clinical teams and to figure out how to connect differently with our patients through technology. And also with each other as healthcare providers, much like you and I are talking today virtually. So some of our staff are working from home and some of our staff are working on site here at the offices. But much of what we're doing has changed drastically in healthcare. So we've navigated those waters really well, and it's not optimal for patient care in all senses, but we are doing our very best to make sure that we're meeting patient needs through just different ways of connecting with them.
It's so difficult because COVID-19 is one thing, but life still goes on, and there are other health issues that we have to deal with, and that's what hospice does so well.
Exactly.
So we just ended Volunteer Appreciation Week. How many volunteers does hospice have, and how have these changes affected the volunteers and impacted hospice in the same sense?
Yeah, it made us sad that we were not able to connect like we normally do for Volunteer Appreciation Week because, as you know, 40 years ago, hospice started with the volunteers as our backbone of our operations way back when. And today we have over 1,000 registered volunteers doing many, many different roles here in the community for us. So for us to be able to celebrate and try to acknowledge the incredible work our volunteers do for us day in and day out was a little bit challenging without having them here. It's like trying to give a virtual hug without being able to give an actual hug. But the truth of it is our volunteers are what they make us who we are, and we are able to do the work we do because of the volunteers. So when this pandemic first started, of course, we had volunteers fulfilling many roles. And again, just like we talked about at the beginning in our operations, we had to determine what was essential and what was not essential for volunteers. And we also wanted to keep our volunteers safe. So across the province, I have the privilege of working with many hospices in Ontario, and we've, since the pandemic has started, we've been on the phone twice a week, at least twice a week. And collectively across the province, we made the determination that it was best to let our volunteers take a step back during this pandemic to keep them safe And so what we've done, the impact of that has been quite significant because the volunteers fulfill many, many hundreds of hours in our residential homes and in our patient homes. So we had to figure out how to redeploy staff to fulfill those roles. So the areas that we were closing per se that were not essential, like staff that were working on our wellness programs or staff that were working on scheduling volunteers, are now working in the volunteers' shoes. So they have very big shoes to fill. So the volunteers that would fulfill roles such as reception, such as kitchen, such as patient care assistants in our residential home are now filled by staff that were previously in other roles. And boy, do we very quickly understand the hard work that the volunteers do. And it gives us an intimate look at what the life is like of a volunteer. And we've had a resounding appreciation for the hard work that they do.
Wow, like I said, we just ended Volunteer Appreciation Week here at YourTV. We miss our volunteers also, and it's almost underappreciated. We need to give volunteers, they just don't get a week, they get the whole year because the value that they provide to us and the joy that they could bring to us and the people that we work with.
Absolutely.
Just incredible. How can, it's a difficult time for a lot of people, but how can people help the hospice during this time?
Well, hospice, as you know, hospice is in Ontario. It isn't just Windsor and Essex, but across Ontario, hospices are typically funded about half of their programs, and the rest of the funding comes through generous donations in the communities. So that COVID-19 hasn't changed that we still are only funded about half of what we need for operations. Currently today, we are receiving still some donations that are coming in, but it's a tough time in this community, and we recognize that as well. We've been very appreciative of receiving generous donations of PPE to keep our staff and our patients safe. We're receiving food that are feeding our healthcare workers and some of our residents, but donations is an important part to keep the operations sufficient throughout the rest of the year. Although we are working very hard with trying to fulfill every avenue for funding that we can. So such as the wage subsidy program through the federal government. And we know that we heard some news this weekend about premium pay for some of the pandemic for our frontline staff. That's a fabulous thing because the frontline staff from day one have honestly put the work of hospice on their back to make sure that there's been no impact to patients and families. And I couldn't be more proud to see all of the examples that the staff are really at the sacrifice of themselves and their families have been here 24/7 to make sure that there hasn't been an impact. We've tried very hard to keep our residential homes COVID-free because we recognize that palliative care and end of life existed before COVID, and it doesn't mean that it's changed. So we've really wanted to make sure that our residential homes remain functional and remain at the best quality of our ability to give the best experience at end of life for patients and families. Our physical building is set up in such a way that we are able to do things somewhat differently than the larger institutions. So we have patio doors and personal patio doors at all the residential suites. So we are able to do things a little bit differently. I received an email this morning from a family member that talked about they had a loved one pass away yesterday, and what a gift it was to have the sun shining on a Sunday afternoon and to be able to have the grandkids and the family, respecting social physical distancing outside, but yet able to come to the window and the patio doors of that loved one's room, to have that opportunity to say goodbye, that in many other instances, we know that that's been very challenging. So we're able at hospice to sort of shift some of what, we are following all the visitor restrictions and making sure we've got all the appropriate measures in place to make sure everyone's safe. But our physical building does allow us at end of life to be able to do things a little bit differently and honor that important goddbye that needs to happen.
Yeah, life doesn't stop because of COVID, does it? It just continues. If people were interested, is there a website where they can make a donation?
We absolutely have an active website. We actually are still here working, so we have all of our phone lines are open. We just really what we're doing right now is we've got all of our entrances locked, and we've got, again, physically we're set up well for this. We have already double doors and intercoms, and so it makes it easy to access us, but it makes it at the same time, while we've got all of our physicians and nurses and social workers still working, it keeps our physical buildings safe. But people can still connect with us. We just are accepting visitors in a different way.
Okay, and the website is?
The website is thehospice.ca.
Excellent.
So www. Yeah.
Great. So that way we've got that word out for them. Lastly, Colleen, what are you looking forward to when this pandemic ends?
That's a big question. So I think that the easiest answer would be connections. So whether it's personally or professionally, we all miss connections. So with our families, to be able to go out for a nice dinner, or with our staff to be able to, after a day, to be able to go celebrate and have a TGIF or go for a coffee. I think it's connections that we all of us are looking forward to returning to, but yet we're realistic in knowing that's going to be some time. There's probably not going to be much of a return to normal, but probably, hopefully, a return to different, and certainly a huge appreciation and a level of perspective that, hopefully we can walk away from and fulfill all of the good that's coming out of this as well.
Well, thank you, Colleen. Thanks for your time. Please offer our heartfelt thanks to all your staff there. We know what great work you do there. Your TV has been a big supporter of hospice over the years. So once again, please stay well and stay safe.
Thank you, Robert. You as well.
I was Colleen Reaume, Executive Director at the Hospice of Windsor and Essex County.